And awareness discussion for this workshop. So that's what we're doing right now. So if everybody has already voted for the posters, then we can lead the discussion on prevention and awareness activities for this year's annual summit. So welcome. If you haven't voted yet, step up, look at the posters, and place your votes.
Is it okay if I say a few words?
You bet.
Yeah. So he's my mentor, and I neglected in my earlier remarks to mention that he's the reason why I'm actually here. Because when we first met a year or two ago, he told me about this summit, and he said to me, wouldn't this be a great project for your students? So once again, with Mentoring in Medicine, we have in-school daily electives in several schools all across the country, from Detroit to Chicago, to New York City, to Washington, D.C., to Maryland. Here in Orlando, Florida, we have students as well. So we have a database of approximately 15,000 students, and we're able to just push out an email. And these 15,000 middle school and high school students are also international as well. So we have students in Haiti, students in Egypt, students in Nigeria. We've been using live streaming as a way to be able to reach a lot more students. And so what you see here is work from both middle school and also high school students. I also want to stress that our specialty is to work with students that come from disadvantaged backgrounds. Our mission is to really diversify the healthcare workforce, not only based upon race, but also based on income as well. Because one of the most fascinating statistics is that almost 90% of all physicians come from the top 10% of all households when it comes to income. And so we really develop a specialty in working with low-income students who don't have access to medical magnets and health science academies. So people, when they see our work, our students' work, they're often saying, wow, it's incredible you have gifted students or students who are interested in becoming doctors. And to me, all students are gifted, but I want you to also realize that in our daily elective, our best students sometimes are not the best students academically throughout the year. So because our focus is hands-on, it's project-based, as you can see that this is a project, we're able to help that C student, that D student come alive. And we've done studies to show that a academically underperforming student will outperform an A student in our program because it's so project-based. And principals tell us that our curriculum showcase skill sets that most students can't showcase in a typical school day. I must admit, to be quite candid, we pushed this out to our database on Monday, and students had until yesterday to submit their posters. So imagine them learning complicated information with only 2 or 3 days notice and then being able to create a poster as a result. We're going to pick a winner, actually 3 winners today. Each of you, we encourage you to vote for one poster. We'll tally up the top 3 vote getters. They'll be receiving a tablet computer. And there's been so much interest in this that we plan to do another version of this. And we'll give the students a lot more time. We'll also encourage you to tell middle school and high school students. There are several college students who kind of said, what about us? And so we'll have a college student division. And also next time we're going to have different categories. So we're going to add a category of radio to do a PSA and also television as well. And so these students are extremely gifted, and I can't stress the fact that, you know, this summit is helping that student who thinks school is boring and why am I here? School now has significant meaning to these young kids because they're able to actually save a life. And so I guess the voting will be officially closing right now. And
Has everybody had a chance to vote?
Are you going to allow them to give them an opportunity to see part of the summit that was reported? So maybe you can see what
Yes, and so I believe I was told this section is being live streamed, and so the students all across the country, I told their teachers about that, so some of them, based upon their schedule, they'll be able to chime in, but most importantly, they'll be watching the video of this as well. So it's really a big deal for a young person to know that their work was presented at a scientific symposium.
So I'm failing to do a very good job of introducing our host of the poster session. This is Andrew Morrison with Mentoring in Medicine, which is based out of New York City. And Lynn Holden his wife is the key leader of the group, but Andrew really does most of the work, I would say, because your wife is busy working in the emergency department in New York City. So we very much appreciate Andrew coming here today to Orlando and having this live stream to the students across the country. And if you haven't had a chance to vote, please do so now, and there'll be continuation of this online that will follow, right?
All right, great.
And so I'm Kevin Sherin, I'm the health officer in Orange County. This is the awareness and prevention segment that's here in this worship center. And so we're going to continue with the discussion about awareness and prevention, and then we'll announce the winners of the poster. Andrew, when can we announce the winners of the poster?
5 more minutes.
5 more minutes. So I'd like to go around the room, and if people can just introduce themselves, maybe you can stand up and say, what organization you're with, and we can get to know you a little bit. Can we do that? Go ahead. All right. So you were the pathology lab here at Florida Hospital?
Yes.
Thank you, Carlos. Ma'am?
I'm Carolina Alvarado, I'm an infection prevention at
Altamont.
Florida Hospital at
Florida Hospital, Altamont. Thank you.
My name is Luciana, I'm an infection prevention officer. And the university I work for Florida Hospital. West Orange, which is proposed by Mr. Garden.
Thank you for coming.
My name is Don Schultz. I'm with Target Remote Management. I'm with Parentheses Shelley.
So you're one of the board members? No. So you're a good friend.
Interested party.
Interested party. Megan?
Yes, I'm Megan, I'm with Florida Hospital for Children, and I'm a health specialist.
Thank you.
My name is Alex. I'm a pediatric nurse at Florida.
Picky, pediatric intensive care unit. Sorry.
I'm Gary Reed, I'm friends with Steve Shelley.
Ma'am?
I'm Patty Smith, I was children's camp, and I'm on the board of the foundation.
Okay. Ma'am, can you introduce yourself?
Hi, my name is Lux. I'm a healthcare medical student.
Thank you,
And I
Lux.
work with medical medicine.
Thank you, Lux. And Doc, you need no introduction, but go ahead.
I'm Jennifer Cope at CDC.
I'm Sandra Gump. I'm here for USF Health and Amoeba season camping.
Dean Bottiger, Florida Department of Health, regional epidemiologist.
I'm Renique, and I go to Seminole State College.
Hey, Monique.
Hi, everyone. I'm Michelle Prasad, epidemiologist with the Florida Department of Health in Orange.
I'm Ashley Vineyard. I'm same as her.
I'm Taylor Campion, epidemiologist at the Florida Department of Health in Orange County.
Okay.
I'm Zina Traman. I'm also epidemiologist, and I'm with Florida Department of Health in Seminole County.
Myrna Chamorro, public information officer for the Health Department in Seminole County.
Anna Scuteri, Florida Department of Health in Seminole, Community and Population Health Division Director.
Hi, I'm Tanya Slade. I'm the Epi Manager at the Florida Department of Health in Seminole County.
Hi, I'm Monica Aber. I'm a physician assistant at Orlando Health.
Hi, I'm Kenyatta Badgett. I'm one of the epidemiologists and perhaps fellow at Seminole County.
We did all right. We got a lot of people in here, and thank you all for introducing yourselves. I guess I'm going to be the facilitator for this session. So we can talk about prevention, and we can talk about awareness. And then rather than just sitting there and towering over all of you and having the lights blazing in my face, which they're going to do anyway, how should we lead off this discussion? I think that the posters are a nice way to begin, because they are really an effort to reach young people, aren't they? And to increase awareness. So I don't know if we're getting ready to announce any winners yet.
Yes, we are.
All right.
All right. We have the winners. All right. Then if I can get a drum roll, please. All right. So the third place winner is poster number 13. This poster right here, that's the third place winner. So we'll give a round of applause to that student who won. The second place winner is poster number 18, right over here. That's the second place winner. And the first place winner by a wide majority is poster number 14, right here. All right, so round of applause to all of our students for their great work. Just so happens that so 13, 14, and also 18. Those are our winners. Thank you so much.
Well, thank you so much, and now you can be on your way to the next event you have to be at.
Happy birthday.
Happy birthday. So we will continue on with our discussion here. What would we want to do with these posters? What kind of venues do we want to put them out into to give Andrew some ideas before he leaves?
They definitely need to be in Spanish and in English. I was just going to say they definitely need to be in Spanish and in English. And that's my 2 cents.
Right, so this is being recorded, so I guess we don't need to worry about recording it, but the winners are 14 was the top winning poster, followed by 18 and then 13. And then the comment is made, the posters need to be in Spanish and English. Other comments about where they need to be? Yes, ma'am.
I think you also should go elementary and middle school and having some of the social clubs that people that are thinking about being in medicine to start them out early, and even going into PTA and having PTA to teach even the parents. That would be my suggestion.
Very cool. Did you also have your hand up or somebody else right here?
I had my hand up, but that was also for the schools. And one question that I have for you, are you on a Facebook? Yes. Okay. So like these posters, especially the winners, or you can put all of them on the Facebook so that people can see.
Other comments?
I'll share your post.
Yeah.
Huh?
I'll share his post on Facebook.
Oh, you're going to share the post on Facebook?
As a matter of fact, it'd be wonderful if everyone maybe took a picture of your favorite poster and you posted it on your Facebook or on your Instagram or on your Twitter. I'm not quite sure if the conference has a special hashtag or not. No? Okay, so we could actually make one up. So you know what? Here's an assignment, conference organizers and also board members. In the next hour or so, let's try to make up a hashtag. So before we leave here, we can have a hashtag. All of us could use that hashtag to post up pictures. That'd be great.
Hashtag Pam, what do you think? Hashtag Pam 2017? How can we do that? Can we make a hashtag Pam 2017?
Well, as an aside, before you decide on the hashtag, first research if someone is using the hashtag. I've seen big corporations become embarrassed because there were certain industries that are already using a hashtag, so let's research it first.
Okay, I don't claim to be a conference organizer. I don't claim to be a board member. I'm just a guy. I'm not even a hashtag guy. I do the hashtag very little. I work for an organization that still doesn't even have the permission to use social media yet in our local level. So, believe it or not. So who here can take ownership of the hashtag social media thing from a conference perspective? I need an owner. I need an owner who works with the conference. Jack, are you the owner? You can't say anything without putting it in the microphone.
I will work on a hashtag. I will do some research. Okay. And we'll get a good catchy one.
All right. Yeah, so
I like the Amoeba Slayers. I think that's great. I like the Amoeba Slayers, but I've been hashtagging 2017 Amoeba Summit on mine and posting pictures.
Yeah, and you can do multiple hashtags. So we have a Jordan Smile hashtag and Amoeba Awareness hashtag. We put everybody needs to know. So we can do multiple hashtags.
you're saying multiple hashtags, Jordan Smile hashtag, Amoeba Slayers hashtag, Amoeba Summit hashtag, and you're suggesting those be the other hashtags, among others.
I would do Jordan Smile for sure, and whether we do Pam Summit or whatever, because people are going to search for hashtags that make sense to them, right? Amoeba Slayers is great, but who's going to think to search for Amoeba Slayers hashtag? True. Probably not going to happen, right? But Pam or Amoeba Awareness, I mean, that's what we did when we first West Jordan, right? You start looking, Googling, right? So that's
Okay, so I think we have a plan, and I think Jack is the owner, and we're going to develop some investigation into the hashtags and have an alternative repertoire of hashtags, right? Any other thoughts? All right, so one is to create more buzz and awareness and use social media. Other thoughts of what you could add under those hashtags? How can we do some more buzz and awareness? Anything else you want to say into that? For creating awareness? No, looks like Jack has a thought.
Well, we can divide up our efforts. We can look at different audiences. So, because we have a lay audience, the public, we have students in schools, we have parents, and then we have the clinical side for awareness, and they both need it. So, maybe as a way of developing our thoughts here, we can trend along those. There may be some people here who are interested in thinking of some novel ways we can approach the lay public, that is schools. Right now, we towards the end of each school year, as you may have heard, Dr. Sherin mentioned, we do some awareness pieces via Facebook and Twitter on some of the different school districts towards the end of the school year when the summer swimming season's coming up. But that's the lay public, and then we have the other audience, the medical audience, the physicians in the EDs. That maybe gives some food for thought, and someone maybe can think up some novel ways to approach, even if we want to go along the lines of the Twitter and the hashtags and things. What are kids in high schools these days? What are some of their, I don't know, what are some of their favorite Facebooks, Twitters, what have you? How can we get the word out, not just to the parents via a letter that goes out at the end of the school year through the school districts, but directly to the children? Just some thoughts.
Okay, those are good thoughts. Yes, well look, we got 2 hands raised. I don't have to do any work at all. This is wonderful. Thank you.
I have a baby son, and we go to the doctor all the time, like every 2 months, I swear. But when we leave, they give us a packet of papers, and maybe they could have like a handout of information for parents to know.
Right, so the thought is to have handouts at the pediatrician offices, and maybe there's a way to template that and then share it with the pediatricians, the Florida Society of Pediatrics, the Central Florida Society of Pediatrics, the Pediatric Associates, the Florida Hospital Medical Group, the Orlando Health Medical Group. We have an Orlando Health representative, Centric Cares. Go ahead, keep going.
Okay, well, the thing that I was thinking about, I know it's, but I'm thinking of teenagers and social media and all that stuff, is have a Amoeba, what is it? Why did I just blank? Emoji.
Emojis.
An Amoeba emoji of some sort, because that would connect to, because they're all into that.
Right.
So,
Amoeba emoji.
I don't know. Remember, I'm a child life specialist, so.
No, yeah, good. Okay, think like a kid.
That's how they understand things.
Yeah, so we got to be. Oh, it's not getting down to it. We all got a child inside of us. That's what they tell us anyway, right? Any other thoughts? This is good. Oh, yeah.
My suggestion would be going out and doing more outreach. Like we have National Night Out coming up soon.
October 3rd.
And you can go out there and approach the parents. You can go to your churches and take information. Even on career day in high school and middle school, you can have someone come from the different clinical side and non-clinical side for like public health and bring information, engaging the kids to think about that.
Okay, so tons of ways to bring it to the community, right? So what is National Night Out? Does everybody know about that on October the 3rd? Everybody know what National Night Out is? Go.
from what I remember last year, is when the police and the community come out, they're engaged, they talk to one another. I know in Seminole County, we went out there with hepatitis. I took my Zika about mosquito control. We also talked about breast cancer, tobacco control, and we also engaged the community to let them know what the health department have in their communities and our different sites. We also had different groups come out with food, entertainment, and we engaged the parents and we engaged the kids. So it's a community night out. It's in all over the country.
It is. It's in all the United States. So here in Central Florida, how many of you are from Orange County? Okay. How many from Lake County? Okay. How many from Seminole County? Okay. Actually, more from Seminole County. Anybody from Osceola County? No. Anybody from any other county? Which county? Putnam? Oh, Pine Hills, but that's Orange County. Pinellas, oh, I'm sorry, Pinellas County. I couldn't hear you, sorry. So every single county has National Night Out. This is a police department thing, so it's the sheriff's office or it's the local police departments. So here in Orange County or in Seminole County, it would be the local police departments. You know, it would be Sanford, Castleberry, Orlando Police Department. They're all participating in that. And the Orange County Sheriff's Office, I know they did it in August, because nationally it is in August, but it's in Florida because of the heat. Florida and Texas also do it on October the 3rd. And that's a community engagement with the police for the neighborhoods, you know? But it's also a conversation where health can come out too. So it can be about health education, and that's an opportunity to come out. But then you have the faith-based organizations. So you have the healthcare organizations, the faith-based organizations, you have the Boys and Girls Clubs, you have Boy Scouts, Girl Scouts. Think of the different organizations that exist in the community that can all be a part of this. You have the PTAs, you have the schools. You know, I can't go through the entire list, but all of these can be sites where we can do some awareness, right? We could bring the hashtags, we could bring the emojis, we could bring posters, right? And we could do that. Yeah. Yeah?
Sorry, I've been working on this. This is my project, so my brain is full. I think we should also develop like a badge for Girl Scouts and Boy Scouts to get them engaged, and they can bring it from their level and also their peers. So that way it'll be one of their projects to get a badge.
Whoa, did you hear that idea? That's really a winner, isn't it? Because that could go national. That could go national, a merit badge for scouting that could go national, or it could go with allied organizations that are like scouting. You have a merit badge that does something about this. You know, you could see the amoeba symbol and it becomes a merit badge that kids within scouting are going to work on. That was a superior idea. It really, truly was.
So I've got an idea, just working backwards from what worked in social media with ALS, is the Ice Bucket Challenge. So especially since it uses water, I think that might tie in nicely with the whole amoeba awareness. So maybe an ice bucket challenge on social media. You can start doing that on the foundation's website. Right.
Yeah, keep going.
So again, because I work in the pediatrics, so I'm thinking, when I see a nose plug and I'm putting myself as a child, it looks scary, it doesn't look fun, it doesn't look that. So if they created something like they have the oxygen masks that are, what are they? What do the oxygen masks have on them? Animals and stuff on them, and are in our children's, and then we have the masks, and children will actually wear them. So if it's something to where, we can do something like create the next new nose plug, but it's child friendly and it looks cool, and unfortunately it has to be like that for some kids and parents to get their children to use it. So something like that.
That's pretty cool. That's great stuff. Wonderful stuff. Look, okay, so is that clock right? 20 minutes at 2? How long do we have for this session? 5 more minutes. We got 5 more minutes. There's really great ideas going here. Preschools.
Well, I know in my daughter's preschool, they have like dental day where a dentist comes in or an orthodontist comes in and they hand out little goodies and stuff like that. So why not have swimming and lake safety and that type of thing, or a lifeguard come in, you know, hitting up the lifeguards in that, in the different areas that could come into preschools and educate and do something fun, and then they bring that fun stuff. Hey, mommy, look what I learned today, type thing.
Yep. And the one that hits me is, you know, I'm thinking it was Sheila Black, who was dressed up with a costume in the laboratory with her team. What if we had, for the real little kids, the costume of the amoeba, okay? Right, the emoji amoeba. And you dressed up like the amoeba, and then you try and raise the awareness of the little kids, okay? And you know, because they're gonna be playing with the slip and slides and all those things, and you know, the garden hoses and all those kind of things. And how do you, the baby pools, and how do you raise the awareness of the little kids? You know, that mommy, not all water is safe, right? And now we've seen the amoeba, we saw the little monster at pre-K or whatever, right? Yes, Dr. Cole.
So I think a lot of these, I hope some of you at the county and state public health levels have heard of our effort at CDC around Healthy and Safe Swimming Week that occurs just prior to Memorial Day weekend. And I think a lot of these ideas that are coming up could be incorporated into activities occurring around that time. It's a kind of broader initiative, not just focused on Naegleria, but it's all oriented around recreational water. And so when you mentioned about preschools, I know that they're, you know, it's up to various health departments how they want to, what they want to do with that observance week. But you can do a lot of outreach activities and take things into the schools around that time. And CDC every year puts out a toolkit of materials for social media and everything. And this year we did, the person who coordinates that whole thing is in my group. And so we've started to incorporate some messages around Naegleria into that because I think it fits as a package when everybody's thinking about getting back out as the summer begins, to kind of keep that, as they're thinking through all the other things they need to think about when they're hitting the water, so.
Yeah, and no one here from another state, but in the Florida Department of Health, it could be done statewide if you're working with health departments.
And as we get closer to our wind-up time, we might want to think about 3 areas that we've all talked about that we really want to pursue from this point to the next summit. And surely there will be some folks who are interested in each one of those. So the night, National Night Out, I would think there would be some, in each county, there might be a particular person that helps coordinate it for the whole county. I don't know, but that was one idea, and then the hashtags and so forth. So we want to be able to report out.
Office, for the most part. The
Okay.
Sheriff's Office will always coordinate at county level, at least in Florida. So, Pinellas, Lake, Orange, Seminole, your Sheriff's Office will be engaged. Yeah.
So the group then, let's decide 3 things then that we want to do for the rest of the year that Dr. Sherin can report out. So I guess it's kind of a matter of voting or whatever y'all want to do. National Night Out, Merit Badge, Facebook, whatever the other items that we talked, the handout to the pediatricians, I think, is a fantastic idea because you're not only educating the parents, but that doctor is also being reminded.
Ma'am, go ahead.
Say that handout, if we could just come up with one that would serve multiple purposes, right? So you're at, like, we did a booth at 5K. We always give out the CDC flyer, always, right? But, if we had one that could go to the pediatricians that can be used at National Night Out, so if we had one that was fit in multiple places, that would probably be good. And again, there is the CDC flyer, which again, we give out, but maybe it's just has a little bit different tone to it.
Well, what do you think about the existing CDC flyer? And you want to say something?
Oh, sorry, go ahead.
Oh, no, and we've talked about updating that or doing a new design on that. So I'm glad you're finding it useful. And yeah, when time allows, I think we'd love to update that too.
But is it okay to just use it now, like National Night?
Oh yeah, no, everything on the CDC website everything we do is for the public use,
So we could, in the short term, use CDC's flyer immediately, okay? With your permission. I mean, that's why you put that stuff out there. We could simply use the CDC's flyer, right? And National Night Out is October 3rd, so there's really no time to really do much planning. It's just a matter of electronically sharing it with the sheriff's office and then having people show up with some copies and making people more aware. Ma'am.
Sorry, I have a lot of ideas. I was just sitting here thinking as a mom, I'm like, where do I sit and look at stuff? When I'm sitting in the pediatrician's office and I'm in the room waiting for the doctor, I read everything in there. I don't know if everybody else does because you kind of get bored of looking at your phone. And so I know that in ours at the medicine specialist for the children's, they have the pool safety and they have but it would be neat to put up in the actual waiting rooms. And the other place I read stuff is in the bathroom. Sorry to disclose that, but in bathrooms, right? On the back of the door.
So we've heard about merit badges. We've heard about the awareness posters, getting them to multiple venues. We've heard about the Facebook. Three things we can do right away.
I think going back to the social media and the hashtag, if we were able to develop a small commercial to play on like iHeartRadio or Pandora on some of the popular stations for the parents and the kids, it's a way to get right in front of them because they do it free. Just a maybe 5-10 second commercial where we can do some hashtags in that too.
Make sure you have your emails and next to your emails and your sign up here, we know what areas you're interested in. If it's the social media, the kinds of things you want to work on over the next year. You've come up with some fantastic ideas. And how do we close this down? Because we've come to the end of our time.
Yeah, what we can do is send out an email to everyone because we didn't have a column for your interest, but we can send out an email that'll provide you the opportunity to let us know what you're interested in. But we have come up with the 3 ideas, and Dr. Sherin's going to share those with the group. We have a year to think of new ones, and we have a year to plan for the next National Night Out. Anybody else have any other ideas you want to share right now? Because ongoing, we will have an email sharing type system, and people can. We should have a way of periodically sharing ideas with the group via our email, kind of like a listserv, if you will.
Definitely we'll have a listserv. So it'd be wonderful to have a SharePoint or something else too.
Yes, as an infection prevention, we have a venue where we share all the information, and we also have APIC. APIC has an annual meeting where every single IP, attend from nationwide and also international. Also, we have FIPIC here, which is the Florida Infection Prevention. So if we can communicate this, because infection prevention specialists, infection prevention nurses, epidemiologists that work at the hospitals are very, very important, and they are very, they play an important role in the communication about the disease, education, and awareness. So that's another venue that we can touch.
That is so true. That is absolutely true. The infection control practitioners. Yes, ma'am.
A lot of kids my age and high school students use Snapchat a lot. So I think that maybe for the next summit, you can do like Amoeba Summit 2018 filter. A lot of kids will probably look it up because we use Snapchat a lot. So some filters.
Outstanding. And thank you all. Thank you all for these contributions. The ideas are wonderful. They are all being captured, and we will stay in touch with all of you. And I know that there's more stuff to follow here, right?
Absolutely. It's all comes from great ideas from everybody in this room right here. And Dr. Sherin, I have to take, he would not want me to do this, but I'm going to do it anyway. This gentleman has been unbelievably fantastic in how he's picked up the awareness ball for Pam. Through the American Public Physicians, American Association of Public Health Physicians. He, as he mentioned earlier, he pushed the resolution through for American Medical Association, which led to the Florida Medical Association adopting it. And Dr. Sherin's done his talk, so I would like to give a big round of applause for everything he's done so far for Pam. Some fantastic awareness group, but everyone will send out emails, and it's just it's your ideas and all us making them come to pass and in saving lives. So thanks very much.
Thank you all.
Thank you.